Department of Health and Mental Hygiene is what we call a super agency. That is, it's not just a public health department, but it includes several other really important pieces. We have a vast array of services within public health, which include those services that are provided within the traditional public health venues in prevention and health promotion. That includes epidemiologic services, cancer and tobacco services, maternal and child health services, and many more. But particularly with Zika, this is of critical importance because we know that Zika doesn't have any specific treatment. Our best defenses against Zika are prevention. And prevention begins with educating the public and providing healthcare literacy about what the public can do specifically to protect themselves against this virus.
Across our department, we have really mounted a coordinated response that involves all programs and staff who work in different areas of the department. We've also done a tremendous collaboration with the State Department of Health and Mental Hygiene, as well as the Maryland State Department of Agriculture, who actually runs mosquito control programs. Some of the work that we've done includes outreach via mass media as well as social media to residents in our county. We've also coordinated individual teams of Department of Health staff who've gone out to targeted communities to conduct mosquito mitigation efforts as well as door-to-door education and outreach, and just trying to answer the questions that our community members might have about mosquitoes as well as their risk of acquiring Zika. Zika is a disease that can certainly affect anyone, and the people who are most at risk are people who have traveled to areas that have Zika as an endemic disease within the community. However, we recognize that there are certain populations that are at higher risk of the disease because of perhaps lack of access to information as well as access to health care.
So here in the infectious diseases community at the health department, we're used to working with a number of partners such as local health departments and mosquito control at our sister agency, the Maryland Department of Agriculture. But Zika has brought a number of issues to light, such as the ramifications for pregnant women, as well as highlighted some of our eroding infrastructure, such as mosquito control, that has really required us to enhance existing relationships and build new relationships.
Mary Center is a federally qualified health center where we provide medical services integrated with social services and education. And we do that really to kind of connect all the dots and put all the pieces together to ensure the best outcomes for our patients. With the departments of health, we really collaborate very closely on collecting the specimens. They actually do our testing, right? So a huge role that I think Mary Center in particular is playing is helping to really navigate the space, collect information, and gain a better understanding of this disease and who's exposed, who's having it, and what the outcomes are.
We have so many different resources available for people if they need them, or if, you know, I think it's a different approach from just a standard outpatient center in that, you know, if you look around, it's family care.
It's a tremendous advantage to have those additional resources within the department, particularly in times when we're caring for issues like Zika or Ebola, which cross all lines.
The future of prevention and health promotion in the state is one that will change from an individual hospital-based focus to more population-based. We are a Medicaid expanded state. We are a state that has embraced the Affordable Care Act. We look at primary care settings. We look at designing community-based programs to address health issues so that we are keeping individuals out of hospitals and keeping them in communities.
We are the boots on the ground. When issues like this come up, we end up being the ones who know our communities and who gather the troops, if you will, to target and to address the issues at hand.
And we will continue to work with our research partners as they look forward to developing vaccines, as they look forward to developing treatments, and reduce the overall burden of this disease in our state.